Okay, so my family, when I was in high school, they fostered a girl. We got her when she was 1.5 years old. We found out about her when she was 6 months old, but we got her when she was 1.5 years. And she was here in the United States. She was from Honduras to receive medical treatment. She had a 1-year visa because she was born with what is called bilateral schizencephaly, which is essentially a cleft. So you know what a cleft palate is. A cleft that extended. Not only did she have a cleft palate, so that her mouth and her nose were actually one big hole. Instead of sucking a finger or a thumb, she would suck her entire fist. But that cleft also extended on the inside, internally, all the way to her brain. So she was missing brain material. When she had her first CT scan with her neurologist, the neurologist hadn't seen her at all. He had literally just seen the scan, the results from the scan. And he walked into the waiting room where my parents and this girl, her name is Senya, was waiting. And Senya was just sitting by my dad. I think her hand was on his leg or something, just standing by my dad. And the neurologist walked in and said, "Wow, she's much more high functioning than I thought she would be." Meaning that most of the patients that have bilateral schizencephaly, they are in a wheelchair or confined to a bed, on a feeding tube, nonverbal, can't walk. And Senya is not like that at all. Senya can walk, talk, play, interact with kids, dance. She loves to dance. She's actually doing cheerleading right now. And from that experience, it was kind of one of these things like, wow, the body is an amazing thing. Like she has this deficit, this lack of tissue, but the body has been able to make new connections and compensate for that in some kind of way through regeneration. So that's really what sparked my interest in regeneration and the regenerative sciences. So no, actually, for forever, as long as I could remember, I wanted to be a vet, which I guess is a kind of scientist. But basically just because I loved animals and I loved to cuddle with furry things. So it wasn't because of the science that I was interested in veterinary medicine. Definitely my indecisiveness. Just because, I started off wanting to be a vet. I was bound and determined. And then I moved to engineering and really loved it a lot. And then, changed. So I've changed my mind a lot. Changed my mind from engineering to math, changed my focus from math to teaching, just because that was the way, it made sense to make money. Changed my mind again. I didn't like teaching, so it's my indecisiveness. Very briefly, I study the kidney, and in particular, I study a group of cells in the kidney that is the interstitial cells, or the stromal cells. These are the cells that provide structure to the kidney. And going deeper than that, I'm looking at the role that these stromal cells have on producing a fully functioning nephron. So the nephron is the functioning unit of the kidney. It is what actually filters the blood, and it is what actually produces urine. So they're absolutely essential, these nephrons, to proper kidney function. We're asking the question, is there a non-cell autonomous signal coming from these stromal cells that actually pattern the nephron into a properly functioning, properly patterned nephron? And if so, can we exploit that in trying to make a nephron in the lab ex vivo to then implant back into people with kidney disease who lack proper kidney function? I really don't know, and I tell people that I have 3 years to figure that out. I'm somebody who ask questions that either haven't been asked or that answers haven't been found to, and then seeks answers for those questions, really about everyday life. So not just in biology, but in physics and in astrology, or not astrology,
astronomy.
Astronomy, thank you. We're not talking about the science here. But one that asks questions and then actively seeks answers for those questions. Most people avoid talking with me, actually avoid the subject altogether. Oh, what do you do? Well, I'm a PhD student. working on my biomedical engineering degree, and they're like, oh, that's nice. And they just kind of trail off, or I get a lot well, that must mean that you're the smart one. And I respond deflating to that. But they don't know how to talk to me, and they avoid the topic. I actually, they try to avoid work topics with me that we're too smart to talk to, that they can't relate to us.
Yeah.
And I think that's why I do get the reaction that I get. They find out that I'm a scientist, and they either avoid the topic and they go to a different topic, but more often they just avoid me altogether, not trying to come up with other common ground, like, hey, do you like sports? Do you like movies? What is a new movie that you've seen recently? I don't live in a lab.
Right.
I go and do things. I love to hike. I love outdoors. I have 2 dogs. I love running with my dogs. So the lab and science is not my life. I am a person. For grad students starting their PhD program, never, ever, ever be afraid to talk to people. Well, and this would apply for undergrads going and thinking about a graduate program too. Never be afraid to talk to people, to get their experience, to get their advice. A lot of people have lots to share and have different experiences than you, so pulling from that advice really is key for somebody who's pursuing, in my first year of the PhD. I learned very on, actually, before I even started the PhD in my teaching career, never be afraid to ask for help. These people that are surrounding you, they've been where you were before, and you go into this lab, and you're like, I know none of these techniques that you do. Don't be afraid to ask for help, because really that's one of the reasons they're there for, is to help you through your training, and you are there to be trained. So seek help, seek advice. I'm entering my 3rd year, and I actually just asked a postdoc earlier today if she could help me with one technique that I'm not completely comfortable with. So I like Big Bang because of the comedy in it. My husband and I we actually binge watched Fargo recently, Stranger Things, Game of Thrones, Walking Dead, NCIS. We love NCIS. We've been watching it for years. My husband, my biological mother, and my dad. It depends on my mood, but either vanilla with hot fudge on it or moose drinks. Neither. I'm Dr. Pepper all the way, although I don't drink sodas very often, but Dr. Pepper, always. Tacos, forever. Not vodka. I did the college thing with vodka, and I can't drink it anymore, so tequila. I drink beer more often, but fancy, not even fancy. If I go and hang out with my mom, it's wine, or with my husband's grandmother, it's wine. So there's occasions for wine, but I drink beer more often. I think so. My husband and I have been looking for a long time for our new house, and we finally got one of our offers accepted. Woohoo! Which is about a month ago. But we close on the house actually 2 weeks from today. So it was getting our offer accepted on our first house ever, which does not mean you have the house, I know. But it will be when I have the keys to my house, my first house ever, in my hands. My daddy, for sure.
Awesome. Well, that concludes our interview session, 20 Questions for a Scientist. Thank you.